Substance use disorders can be difficult to diagnose, especially because people at different points have different insight into the level of their substance use. As clinicians, we look for sustained use of a substance over time that's impairing their function. And this can happen quick with opioids because they're a very difficult molecule to stop using once you take it. It provides, for some people, a very dramatic intoxication state that one wants more of from a prescribed opiate or from opiates used on the street. And then you end up with an opioid use disorder. Once you start using, you get this incredible dopamine spike that you want to replicate. And then what happens as you use over time is that you get the dopamine spike in your brain about acquiring the substance. And so basically your neurocircuitry gets rewired and so that your brain is just motivated to use. And the way that plays out is that using opioids becomes the answer to every question because your brain's sort of wired in that direction. It's what to do after school, after work, what to do when you're feeling anxious, bored, want to have fun. And you lose that menu of options of things that you can do. And you can get very quickly into this physical dependence on it where it becomes very hard to not use or you go in withdrawal. Opiate withdrawal is a very unpleasant state, and it's often the reason that people keep using once they've started using. And that basically everything, you feel anxious, everything runs, your nose runs, you can have uncomfortable stomach symptoms, feel cold and shiver. And it's a very unpleasant physical state to be in. And so often those that are either prescribed opiates chronically or are misusing opiates in the community, they're very fearful of this state, and that's what perpetuates use going forward for a lot of folks. The biggest misconception about substance use disorders is it's bad people doing bad things, and it's not a brain disease. I think the biggest disservice that is done for addiction overall is this idea that we need to punish people for it, and it's bad people making bad choices. But there's certain people with a genetic risk or environmental risk, and it becomes almost impossible for them to stop because their brain gets hijacked with a substance use disorder.
Well, there was a time in my life where I thought that, some people are meant to do well, some people are meant to do drugs. Some people are meant to die from drugs. Some people are just bad. And I just want to tell people that that's not true. Like, we all deserve a decent life. I deserve a decent life, and so do you. So,
folks with addiction aren't bad people becoming good, but they're sick people becoming well. And I think that's the proper way to think about addiction and substance use disorders, and not as something that we need to arrest our way out of or punish, but really that deserves sensitive, compassionate medical treatment.